Hi, my name is Colin Gardner and I'm a dentist working at Botanix Dental Care. I qualified from Dundee University back in 1989 and I've worked mainly in private practice ever since. I withdrew from the NHS back in 1992. Since then I've worked with corporates, I have worked for the armed forces, I've worked within the prison service. I started my work in implantology back in the late 1990s at a time when CT scanners were not available, nor were bone grafting techniques. And since then, I've observed huge changes in how we can plan our treatment and also how we can implement it to the benefit of our patients in a much better system and structure. A ballpark figure for a fully restored implant is somewhere between £2,500 and £3,000 per unit. The initial consultation is £75, and during that appointment we'll do a very detailed examination. It lasts roughly 45 to 60 minutes, and during that I will look at over 30 different points outside and inside your mouth and also explain whether you're a suitable candidate. If possible, I will guide you as to whether you're likely to need additional treatment such as a bone augmentation or a sinus lift, but it's not always possible to do that at that first appointment. Once we have our investigations together, I will provide you with a full written estimate explaining what the treatments are that you're likely to need and explaining in great detail what's involved. What I want to achieve is that by the time any patient is sat in my chair ready to have treatment done, they understand what it is I'm recommending, why I'm recommending it, what it involves, and also how much it will cost, so that they can make a fully informed decision as to how they'd like to proceed. Whenever you're missing a tooth, we have 4 different options, each of which should be looked at, even if that's just to exclude it from our treatment plan. The very best that we can do is always a dental implant, and the reason that's so good is that it's the nearest we can get to giving you your own tooth back. It's standalone, so it doesn't affect the adjacent teeth, and equally the adjacent teeth don't affect the implant. Therefore, if anything goes wrong with the implant, it doesn't affect those adjacent teeth, and if anything goes wrong with the adjacent teeth, it doesn't affect the implants. As soon as a tooth is removed, the gum and the bone start to shrink. If we place and load an implant, that rate of shrinkage slows down, so it actually slows down the aging process. As I said, this is the nearest we can get to giving you your own tooth back, and the way you look after it, we will show you the best brushing technique and flossing techniques to keep it clean. The next step down, if an implant isn't appropriate for you, would be a conventional bridge, where we use the adjacent teeth to support the missing tooth. This is great in that it is fixed in place, however, it inevitably involves damage to those adjacent teeth, which over a long period of time will actually shorten the longevity of those teeth. If a conventional bridge isn't possible or isn't for you, then the next step down would be denture, either partial or full. The great thing about dentures is that they're cost effective, they're relatively cheap. You can remove them for cleaning after eating, but because you can remove them, they will also tend to move around when you're eating and talking. And so for a lot of people, they feel that that removable option is not best for them. And the final option, which should also be considered, is to actually accept the space. Now, for a front tooth, there are very few people who that would be feasible for, but sometimes for a back tooth, that's an acceptable version, and we should certainly look at it and exclude it if appropriate. It's certainly the case that an implant is not like the root of a tooth. Frequently it will get compared to that, but in actual fact it is frequently much stronger than a natural tooth, which means that we can use a smaller number of implants to replace a larger number of teeth. It's not uncommon to have 2 implants replacing 4 teeth and sometimes more, and in extreme cases where we're replacing the full arch of teeth, what we can do is replace 10 to 12 teeth with just 5 or 6 implants. So we frequently get asked whether implants will be possible for someone, and in the vast majority of cases the answer is yes. It's just whether that treatment is appropriate for you, so that's your decision. In the past, it was certainly the case that there were much harder situations to actually place an implant, but nowadays with modern technology, modern augmentation techniques, a sinus lift, it's very unusual that we can't restore with an implant. Some things to take into account though would be medical history conditions. such as uncontrolled diabetes, or indeed if you smoke, this nicotine restricts the blood flow to the gum and the bone around teeth, so it will actually impair the healing process. That doesn't mean that we won't do implants for someone who smokes. We would always strongly recommend to consider stopping smoking, not just for the benefits for their dental implant treatment, but also for their health in general. However, we can place implants on people where they do smoke or find it difficult to stop, on the understanding that we cannot offer the same guarantees that we can for someone who doesn't smoke, because they will actually be putting the healing process at risk. So another question I get asked is, how long will my dental implant last? And the answer to that is, I'm afraid, it depends. We will show you with our hygienist how to look after it properly, how to keep it clean, how to reduce the risk of disease around about it. Just as teeth can get gum disease, implants can get something called peri-implant disease, which can eventually lead to the loss of that implant. There are treatments available for that, and we can help to try and prevent it. But if it should happen, we can treat it, and you should expect to get many, many years out of your implant. Here at Botanix Dental Care, we use the very latest in technologies, so all of the implant cases are planned digitally using our digital impression. So instead of study models, we have an impression on a computer screen. This allows me to stitch the model onto the CT scan, and I can reverse engineer how we actually place our implants. So on your model, I will add in the false teeth where they should be. That dictates where the implants will go, which will then show up on our CT scan and allow me to see, do you have enough bone there? Do we need to add additional bone or complete something called a sinus lift? This means that by the time we come to do surgery, everything has already been planned. We use a system which is in the top 4 of implant systems within the world. My own success rate with this implant system is 98%. Because of that, I'm able to offer a guarantee that we will replace your implant for free should it fail within the first year. It's not just about me. What you'll see when you come to the practice is that we have a whole team who will look after you, make sure that your level of service which we provide is world class, and that what can be a daunting experience becomes a pleasurable one for you. What we want to achieve is that every single patient who's been through our patient journey has found it an excellent service, and they feel ready to come back again should they need anything else. Take a look at the testimonials on our website. They're all 5-star, and the reason for that is because we put in that extra effort to look after people.